Good morning, everyone. Sorry for the few minutes delay. Firstly, I'd like to acknowledge the Gamaragal people of the Eora Nation where we meet today and pay my respects to elders past and present and Aboriginal people here today. This was, is and always will be Aboriginal land and we're very lucky to be here. Now, this is probably somewhat of a novel experience. If you saw an email or got tapped on the shoulder to come to a budget roadshow, I guess you thought you'd rather stick pins in your eyes. That may need to be edited. However, I really, and on a serious note, I really want to work with all of you and to share what's going on in terms of things like budget and how decisions are made and how we're going to work together. We've got finite resources, they're very precious resources. We do get a large sum of money, but we care for a large group of people as well. And I just want to make sure we do that in the most sensible, rational, caring and effective way that we possibly can. So the purposes of these roadshows are to meet with as many staff as possible, walk you through the achievements of the year that was, because my goodness, there was a lot and I won't be able to cover off on all of them. There just isn't enough time. But I think it's really important to reflect on the hard work and the efforts that you've made in the previous year and what you've done for your patients and the community, because this might be about budget, but budget is not the story. It's the patient care and how we deliver that. That's what's important to me, and I know is important to you. And this will be filmed, and so the idea will be that the video will go up on the website so those of you who decide it's the most thrilling morning you've ever had can tell your colleagues and get them to get online and watch the video when it's done, because again I want as many people as possible to hear and see what we're working towards. Jackie Ferguson, Director of Finance, is here with me and we'll do a segment here just to walk you through some of the detail of the budget process. And whilst not everybody is a manager of a budget, all of us have a role to play in how we deliver services. And I don't know how many of you went to the innovation program the other night, but I know really well that staff are constantly looking at better ways to give care. And 9 times out of 10, the better ways to give care will be an efficient or more effective way to give care. So I think if we think about it in those terms, it will be good. Just going to go through the highlights from last year, of which I said are quite a lot. Some brief covering off on some capital. We are not an island. We do have to work within the priorities of the state and especially the premiers and New South Wales Health, and then of course our own local priorities. We'll run through the results of last year and we'll run through the budget process with the ministry this year and what the carve-up is from Treasury, and then what our budget application is this year, and we've got some modest enhancements and some new developments that we'll be able to provide in the year ahead. So again, I think it's just really important to sort of go through, and as I reflected on these numbers as they were pulled together for me, I thought no wonder everybody's a bit tired, everyone's been under the pump. So across the district, you performed 565,000 operations. You provided care to more than 200,000 people in emergency departments, and more than 600,000 people received services in outpatients, and more than 5,000 babies have been born, and around almost 85,000 community health services. Around 3,720 patients were treated in their home, in hospital in the home. We immunised 94% of non-Aboriginal kids, and really pleasingly 96.4% of Aboriginal children at 1 year of age. We've enrolled 55 kids in the Go for Fun, or centres in the Go for Fun Children's Initiative, with 91% completing the program, and we've got all of you and your colleagues across the district, around 11,000 people delivering nursing, medical care, allied health and the other really important services that enable the clinical staff to do what they do. We've not only done all of that, but you've pretty much done most things better than you did the year before. So we're measured within an inch of our lives, which I know KPIs are fatiguing for all of us, but it is important that we are accountable for what we do and we can be measured by what we do, but they're not the full story. So we pretty much met all of our KPIs, including the dreaded ETP. The most outstanding effort in relation to surgery, 000 for the first time in a very, very long time. So that means every patient received their surgical care within the recommended timeframes, and that is that is quite something when you think about how what a stressful thing it is to come and have your operation and to be cancelled or not to be done when you thought it was going to be done. So this is sensational. Yes, the surgeons did it, but they didn't do it alone. And whether it's the cleaners in the surgical in our theatres, obviously the nursing staff, the people in the admission office, the whole breadth of people that were involved in that. So that's outstanding. The winter flu season last year was just a shocker. Fortunately, touch wood, this year is playing out not so devastatingly. With 11% increase in people coming to the ED, we've reduced our falls, we've reduced our pressure injuries, which are very important, of course. And in terms of the People Matter survey, this one I'm really, really happy about because it's not just about the percentage, what it says about more people participating in it. And I'm hoping that's not because we badgered everybody, but because people believe it's worth filling it in because something will change or something will be better because they did. And pleasingly, we hit 69% in terms of the sort of bunching up of the questions. That tells you 69% of our staff felt were engaged in the process. And you can see there the state average was 65. So the workforce people tell me that, once you start to hit around 70, you start to move into an area which is really best practice in industry. So I think we should be pretty pleased with that. E-meds, my goodness, at Ryde and Royal North Shore Hospital, massive undertaking. I had experienced the rollout of e-meds at Royal Prince Alfred Hospital when I was there. I've not seen the level of, to use the hackneyed phrase, of engagement around the clinical staff and all the staff that I've seen here at North Shore and Ryde. It's been nothing but exceptional. And for North Shore to roll this out in 4 weeks, really, it's a record. It'll stay on the record books. And we're on track to go live at Hornsby in fact, they have gone live this month. Now, a little bit closer to home for you guys. We have to start with the first highlight, and that's the appointment of a general manager in Alison Zechen. And I'm pretty confident that that's been one of my better decisions. I get tremendous feedback about that, and I do think it's really important that a hospital of this size has its own general manager. And we're obviously working very closely with the whole exec team, and I think it's shaping up to be a really bumper relationship and a really good few years ahead of us, I'm sure. I would just make the comment that, I know I send out a lot of emails about appointments of positions, and I just want to, reassure people that there are only been 2 additional appointments to the district executive or to the executive, and that is the appointment of the general manager of Royal North Shore Hospital, and the second one relates to Northern Beaches. We're required to have a position called a relationship manager, so that once that hospital opens, that's sort of our general manager for Northern Beaches. All of the other positions that I've put in place are essentially replacements or swapsies for ones that were already there. So I understand sometimes you see these things and think, my goodness, how many more people does she need? So Alison, elective surgery, as we've already talked about, some great results in stroke. I met with Martin and the team the other day, and that whole team is doing outstanding work, and those figures speak for themselves. We've got the new childcare centre. Dee Dee just loves it, her and the team. They're just mental about it. And the acute surgical unit, our new model of care to streamline access to theatres. For Hornsby, again, the surgery, they also had great results in terms of their ED care, and when the BHI put out their report, we get pre-briefed and we hold our breath and we hope we're all okay. We got on the front page of the newspaper, and you don't often get on the front page for a good thing. Well, we did, and that's because Hornsby started, the most patients, 90.5%, had their treatment started on time. And then, of course, in the ASMOF, the survey done by ASMOF, and that the JMOs rated Hornsby the best place to work. And, of course, Hornsby's very lucky to be having this major redevelopment, which really is going to change the face of Hornsby. Manly and Mona Vale have continued to perform extremely well in terms of ETP. Their performance hasn't wobbled in the least, and they're going through significant change out there, but they remain incredibly focused on their patient care and put their own concerns to one side. It's a real credit to them. Nursing Team of the Year at Manly, and the Medical Assessment Unit was awarded the best unit in the state. Ryde, the appointment of Heather Goff. Some of you may already know Heather. She's been a very senior and professional person in this district for some time. And obviously with the split of North Shore and Ryde, with the general manager appointment there, the sequelae of that was a GM at Ryde. They too are doing incredibly well in terms of their performance targets. The Ryde Hospital is a little tired, it's fair to say, but they have had some refurbishments over the year, including the ICU and one of their wards. And as we mentioned, EMEDS has been rolled out. Mental health, drug and alcohol, incredibly important service. It impinges heavily on the acute services, and it's an ever-increasing strain in our community. We do incredibly well, this mental health, drug and alcohol service, when benchmarked across the state, and these are just a few of the things that I guess are considered to be really high-performing parts of that directorate. Primary and community health, we opened the beautiful Brookvale Community Health Centre. We do incredibly well when it comes to universal home visiting, and our STEPS program for littlies is performing incredibly well, screening over nearly 11,000 kids last year. Aboriginal Health, we had some of you may have attended, we launched the Aboriginal Health Plan. I love doing things in the foyer of this hospital. Partly it's beautiful, and Bronwyn Bancroft's painting in the background certainly helps. But just when you're doing things and the general public and visitors and all the staff are wandering through, it's terrific. That was a great launch. We had the Women's Health Check Day, and some of you may have contributed to that. That was really a fantastically attended event. And we've got 2 trainees who've completed their dental assisting in the oral health trainee program, which is terrific as well. Allied Health, unsung heroes in the health system, I always feel. Jim Elliott has been appointed. He's an academic, great guy, incredibly capable clinical researcher, and between him and Julia's appointment, they're really going to put a zing in the step of Allied Health. I had moved Allied Health from reporting under the Director of Nursing. That's no slight on the Director of Nursing. That's because I think Allied Health should report to the Chief Executive. They've undertaking a whole lot of work around research and surveying people about their interests and needs for research, and we've got an Allied Health dashboard which is under development. In ICT, there's a raft of things. The Wi-Fi stuff has gone really well. I mean, I don't know what the feedback is from patients, but I understand that's been very well received. OMIS, the oncology system, has just went live on the 14th, and we're doing some work on our website. I know that when you look at most health or government websites, they're not the most exciting places to visit, but they're increasingly important in terms of communicating with our community and with our patients and with each other. So we're starting a body of work to see what we can do there to reinvigorate. The Hornsby Hospital was the first to achieve the integration with Pyxis, and we were the first area to implement EMEDS as part of our hospital in the home. So it's always good to have a few firsts to brag about. I'm sorry this is a long list, but I think it's really important that we just run through them. The Exceptional People Awards, I had the greatest joy, I think my second day in the job, to head out there to the golf club and MC it. It was absolutely fantastic. So we're doing it again on the 14th of September. Speaking Up for Safety, a culture program that we're working with you on, which you'll hear much more about and probably know a lot more about it than I even do. And we had 4 women in the winners in the top 50 Public Sector Women's Award. Without sounding silly, 2 of us are in the room, Liz Murphy. What was great about that was that I think there was out of the 50, about 18 came from health, 4 came from this district. So I think we should be very proud of that. Claire Skinner heads up the ED at Hornsby, Liz Murphy, who's here, myself, and Jackie Edgley, who's been the Don at Manly and is now at Mona Vale and is now going to be the GM of Mona Vale. We've set up a JMO Wellbeing Committee. Harry Nespelin, a GP and board member, he's going to look after that one for us. Quality and safety, you nailed it in terms of accreditation. Insurance awards, we've got 3 of those listed in that. We're bound to win something. And we've got these beautiful volunteers around this district who just give that special something to us every day and to our patients. And we've done a lot of work around QI. There's a zillion of them. The quality account, really a good initiative. It sounds dry, but it's about saying, you know, we have an account with the ministry around money. Surely quality and safety deserves its own account, and so that is a new process that we're participating in. We've got Mary Chiarella, Board Chair, will be known to many of you, incredibly enthusiastic about driving a fresh agenda in safety and quality here with us. Consumer Committee, Ralph is a great appointment in the Community Partnerships team, and we have had some consumers on the panel for our innovation program judging, and they've just loved it. We've, in research, the Director of the Colling is underway. We're starting a planning process about our strategic plan for research across the district, and with the university there are a number of very senior and important appointments that have come about which are really going to help lift our profile. A ton of work going on in the Colling, a lot more to do, but we're very lucky to have such a facility as part of our campus, and work is underway to establish, under Tom Hughes' leadership, our Surgical Education Research and Training Institute. The innovation program we've talked about, some great winners. Sally was just outstanding. There are many more great people who have won and even not won, who I can't help but support their programs, even though I'm not meant to. Communication, you know, I can't speak more highly of the team and how hard they work, and it's such a battle to get the messages out there, but you know, we're really penetrating our community. Social media is changed everything, as you know, and we're really building it out there in terms of Facebook and getting stories out in our local papers, newsletters, and a series of events to profile what you're all doing. So that's the year that was. It rolls off the tongue, and as I say, no wonder people are a little tired, but it's commendable, and I'm just incredibly impressed. Here is some of the capital that has been provided over the past year. Some of them are a little dross. A laundry doesn't sound great, but geez, it's really important that we've got clean sheets for people. So that's been the investment over the past year. Now I'm coming to the sort of budget part, so I'm not going to spend a lot of time on this. Just to give context, there are state and Premier's priorities that we are required to commit to. They cover a whole range of areas, you know, housing and education, homelessness, domestic violence. You'd struggle to see one of those that health didn't have some role to play, even if health wasn't directly the priority. Of course, we are that too. These are New South Wales Health strategic priorities, so these sort of guide and drive the service agreement and the things that we need to comply with and do. And then we have our own. This is the district's plan that was launched late last year. And then it comes to the budget. So I'm going to hand over to Jackie now just to walk you through, just, you know, fairly briefly around the processes around the health budget and where we've got to for our new financial year.
Good morning, everybody. Those who don't know me, I'm Jackie Ferguson. I'm the Director of Finance and Corporate Services for the district. So I'll just walk you through. This is the state budget. So it looks a really nice large sum of $25.1 billion. I wish we had that locally to spend, but unfortunately we don't. So, and that's made up of our expense budget, which is $22.9 billion, and a capital expenditure budget, which is across the state. So an awful lot of cash flying around. The state price, which is our national weighted activity unit, I'm not sure that the activity that's purchased is all paid in an NWAR. So if you hear of the NWAR, that's our activity unit. And the state price for this year is $4,713. We don't get paid that price. Our price is based on what it actually costs us to run our services, which is rebased every year through our costing process. So around the district, I'm sure you hear about the costing process going on every year and now every 6 months. That's actually costing each patient that runs through our service, and actually goes back into the ministry, and then at the end of the year we're actually allocated a local price for our services. So we've got 4,675 for this year. Just to put things in context, really, this is how the expenditure budget is actually broken up. So as you can see, there's a huge proportion of employee-related costs, especially if you take the employee and the VMOs, which are classed as employee-related costs. That's why there's a huge emphasis on FTE management and premium labour, etc., because they make up such a large part of our budget. So this is our local budget now, so this is all about us as Northern Sydney, and we have an expenditure budget of $1.672 billion for the year 18-19. I'll run you through a little bit about how we actually allocate the budget build in a little while, but the activity note negotiations with the Ministry is really important to know, because although we've just started in a new financial year, we'll actually start talking to the Ministry in November about next financial year. So just as we start one year, we're actually talking about the future. So we have a real opportunity there of actually going to the Ministry and asking what this district requires in the coming year. So, and it's a very long process. We start in November. We actually don't reach agreement until May the following year, just before we get our service agreement. So there's lots of opportunities to talk to the Ministry. So we really need you guys to input to us the priorities that are running across the district. As I said before, the components of our funding is around activity-based funding. So we're paid for the activity we do. We also get an element of block funding. So this covers services that aren't activity related. So examples of that is population health, health promotion, Aboriginal health, some of community services, and also some of mental health services. So they don't have activity targets, so they're block funded instead. So we have all that sort of separated out for us. One of our larger challenges is our revenue budgets. So we're always, every year we have our own source revenue to achieve, which is always over $200 million, so 267 I think for this year, which was, it's quite a hard target to reach, and I'm sure everybody experiences that day to day, trying to get private patient conversions. We also have growth funding. So our growth funding is based on our population and equity readjustment over the years. So it's looking at what our district, how it's growing in comparison with the rest of the state. There's been a little bit of a change in the growth funding this year, which I think it's really important for people to know. In the past, we've always been funded 100% of our price for growth. This year, they've actually introduced that we only get paid 90% of that price. And the reasoning behind that is that you can do more activity without increasing your overheads. So they're really forcing us to focus on the front line and pushing the costs down to the front line, but to maintain our overhead structures as much as we can at the same rate. Now the processes of allocations. So basically the district receives a service agreement from the Ministry. So that sets out all those components there. District Finance then have the wonderful job of allocating it out to the facilities and the directorate. So we try to do that in a very transparent way. We mirror as much as we can the activity-based side of things, and we talk to the GMs and the service directors on what their plans are for the coming year, and to make sure as far as possible it's a manageable budget. No one's ever happy. I don't think I've come across a GM who said they've been happy with their budget, but as far as we can, we try to be very transparent and know probably where the hot spots are. So, a little bit of reflection. So this is our results for 17-18. So as you can see, we were overspent by $9.275 million for the year. Put it in a little bit more context, that's less than 1% of our budget. So it's not a bad result. Unfortunately, one of the main KPIs we have with the Ministry is that our expenditure and revenue budgets, we have to have a zero variance on. So that's what Deb as CE and the district are actually monitored on. Now, as you can see, their expenditure of the year, incredibly, we got very, very close to budget, $68,000, which is like enormously close. But the revenue, unfortunately, wasn't. So this is really where we're struggling a little bit with the revenue targets that we have. And the other, now that's mainly our write-offs. So that's revenue that we've raised that ultimately then we've had to write off. So those two are very interrelated. The reason why the Ministry don't concentrate too much on the other, although it's part of our net cost of service, is the timing of those write-offs. So some of those write-offs could be 2 years old, so it's not particularly relevant for the year that we're looking at. And then below that's the SP&T funds, so that's all the special purpose funds or restricted financial assets as we now call them, and custodial funds, which are the rights of private practice. As you can see, the net figure is just over $1 million favourable, so really we're not too concerned about the SP&T as long as we're not spending more than we're bringing in. So we're maintaining our SP&T balances moving forward. So this is broken down in a little bit more detail, so you can all focus on the top line, which is Royal North Shore. So they were $11 million unfavourable. That was a mixture of revenue and expenditure, obviously, and a lot of the pressures there are on FTE and revenue generation. Unfortunately, you know, that there's a slight decline in Royal North Shore, Manly, Mona Vale, Mental Health and Patch. It was only Hornsby and Ryde that actually improved their variance to budget. So we've still got a little bit of work to do this year to bring things back online. And now this is the budget that we hand down to all the GMs and service directors, and these are actually published on the internet and intranet. So you can all go along and have a look at this. We tried to be very transparent about the activity volumes at the bottom. Also set an FTE budget target, and then it's broken down between activity-based, block funding, and then any other initiatives that are given to the hospitals. So there's one of these for each of the facilities and services. Wonderful roadmaps. I'm sure most people know. The roadmaps are set by the Ministry of Health, so it is a target we have to, and there are efficiency targets that we have to achieve. Unfortunately, the productivity one, which is very, very high for us this year, $32 million of productivity gains, is one that if we don't achieve in 1 year, they actually carry the balance forward, which is why we've got such a large balance. So unfortunately, you know, we're struggling to keep up with that productivity target. Our expense and revenue far more manageable, but we talk to all the facilities and work with them to actually build up the roadmaps for the year. And there's a real emphasis, we do need your help on these. They're your achievements really, and some of the productivity ones that Deb and I have spoken to some of the network directors, they're happening anyway, but we just don't showcase them. We don't actually bring them forward and actually put them as roadmaps. So that's what we're trying to do this year. So Scott and the team are going around to all the facilities to try and work with them a little bit closer. So that's where my bit ends, but I just want to say before I go that, you know, I'm very proud to be the Director of Finance, returning to the district after a few years away, but I really want to make sure that we utilise our finance team. We've got a large district team and good facility teams as well. We want to make sure that we're there for you as the business and make sure that we actually provide you with the service you need. So just want to make that point before I hand over.
Okay. So for the year ahead, we had some modest enhancements came through from the ministry, and I just thought I'd run through some of them today. So firstly, you know, as you've already heard, Hornsby is getting its redevelopment. We've had the sod turning there, so that's all good. And the multi-storey car park is underway. They're suffering through dust and jackhammers there at the moment, but a shuttle bus to Westfields to and from work at the moment. We've been able to invest in medical imaging at Hornsby for the new hospital, in their, you know, all new equipment and fitting out the medical imaging department there. And we've recently just got $250,000 to enhance the physical environment for children from Hornsby, including those with mobility issues, and been able to invest in some additional ED staff specialists in Hornsby's emergency department to support earlier and senior decision making. For Ryde Hospital, around $250,000 in additional ICU staff, mainly senior medical staff, to support that important department in the hospital. And at Royal North Shore, we've got three main initiatives, that being palliative care, dialysis, and pancreatic cancer. So that's been, we put up about half a dozen, perhaps even more, initiatives to the ministry for their consideration, and these are the three that we were successful with. So firstly, in relation to palliative care, many of you will know Katie Clark. She's working incredibly hard to make a seamless palliative care service for our community in northern Sydney. Renal dialysis, really that just reflects the increased demand with an ageing population, increasing numbers of people requiring supportive renal care. And pancreatic cancer, this district, as you all know, it's a terrible disease with mostly terrible outcomes for people. But this hospital in particular has outstanding outcomes in pancreatic care in terms of survival rate. And we think it's important that we invest in that and show ourselves to be the place, really, if you want the top care, this is where it's at. Mental health and drug and alcohol, with some $1 million in additional nursing staff there, and leading better value care. There's more work to be done in the allocation of these funds, but we've got activity or NWAR funding of around 700,000 and some block funding of around $250,000. And over the coming weeks we'll be working with you all to allocate those funds. Northern Beaches, it's a very different time for them. So Manly Hospital, as you know, is closing, and Monavale is being reconfigured into a subacute hospital. We have around 900 staff leaving those facilities to go and work for HealthScope. It's a massive change. It's a big one for the community. It's a big one for those staff. So shutting the doors on Manly on that last day is going to be it's going to be an incredible process, the patient transfer process, but it's going to be tinged with some sadness. Monavale Hospital is going to be rejuvenated. It has a very, very beautiful community health centre and rehab centre. It's now going to be complemented with a 10-bed inpatient palliative care unit, as well as a geriatric unit, and the design and planning, both with staff and the community, is underway. The urgent care centre will replace the emergency department as we know it, because obviously the new Northern Beaches Hospital will be providing a large, high-level emergency department for that part of our community. ICT, we've appointed our first Chief Nursing Information Officer. Many of you will know Marty Sterrett. He's been a one-man band in that regard for some time. We thought it was only about time we had a friend to help him. So Sally's a great appointment, and I think in this age of ICT, informatics, analytics, having clinical people who love this stuff to work with clinicians to support them is really important. Website I've already mentioned, the rollout for the next wave in EMR, ERIC in intensive care, PACS for imaging, and we're going to try and boost our efforts in relation to informatics and analytics this year. We're very lucky to have Professor Jonathan Morris in this district, and he's probably one of the national gurus on this stuff, so we're going to be working with him to see how we can better support research and clinical research here. eHealth too are working with us and committing some funding, and we're going to be the lead site for this in the state. Aboriginal Health, I'm pleased to say, will soon be moving to the Community Health Centre building. It's been sort of down the back there and not as welcoming as we need to be for our Aboriginal community. Putting in an additional RN to assist with the Great Bungie Vigil, Aboriginal Liaison Officer and an Indigenous Health Project Officer to support that team. We don't have a large Aboriginal community living in Northern Sydney Local Health District, but we certainly have a large number of Aboriginal people who come here for our services, and we want them to feel supported and safe in our care. So we're coming to the last slide, you'll be pleased to know, 37. It's a lot for first thing in the morning. Just a couple of messages I just want to leave you with. Being sustainable in every sense of the word is what we need to be. I don't want us constantly focus on cost centre budgets and money and revenue, albeit that will be the bread and butter that we'll always have to do. I want us to be able to get in a position where we can think beyond that and start thinking and planning for the things we want to do. And part of that, being able to do that, as Jackie said, we can't do it without all of you. I want a strong and meaningful connection with all staff in the hospital. I want an environment where you feel like you can innovate and your ideas are going to be listened. And I think, again, those of you who went to the innovation program this week, it's just there's what is it like SBS, a billion untold stories in this district that I want to hear about. We want to make sure you've got good access to data that will really help you make good decisions and explain the decisions in a transparent way. We want to make sure you feel supported with education and training, and some of that will be around financial management, some of that will be around ABF and managing activity. But these are difficult concepts, and people like me and Jackie and Joe live and breathe this stuff every day. I want you to live and breathe patient care, but there are times where you just need to help us and know a bit about this stuff. We're going to have good financial controls and processes that make decisions transparent. And finally, I want you to know, as Jackie said, that the executive team are really here to grease the wheels so you can get on and give good, great, high quality patient care. And I know sometimes it feels like we get in the way. We don't mean to. Our aim when we get out of bed every day is to make sure we can get things as good as we can for all of you. So put your hand up if we're not. Tell me. Tell all of us as you see us. We hope we're visible. We want to be visible, and we're always keen to hear from you. And that's the wrap. So again, I know that it's early in a Friday morning to be hearing all of that. This really is for me the start of the way I want to work with all of you, and that we share all this information. You understand why decisions are being made. We won't always have enough money, may not always like the decisions, but at least you'll know why. And I thank you very much for your time this morning.